So our next speaker is Sue Ranger, who's a consultant clinical psychologist, and she is a national expert. Very privileged to have her in infant mental health. But that's in the background of 30 years of NHS clinical psychology. She's been involved in national projects, including the 1001 Critical Days, which talks about the relationship from conception right through to 2 years of age, and how the influence of staff members can make sure that that relationship between mother and baby or caregiver and baby is as good as possible. Multiple awards, and the one that stood out was that she was Clinical Leader of the Year in the Health Service Journal, one of the finalists for that. So we're delighted to have you here today. Thank you.
Thank you. I forgot my instructions about setting up the presentation, so that's not a good start. Okay. I think I will come back down off the podium, if that's okay. Thank you very much for inviting me to come along and speak to you today. I very much hope that what I'm going to talk about will be of interest and of some use to you. A little bit left field, I think, but hopefully of interest nonetheless. What I'd like to cover in the next half an hour or so is to talk to you a little bit about why the prenatal experience is important for infants and the impact on early brain development and the foundations of the stress response. To think about maternal and infant sort of presentation in terms of the situation that you will be dealing with these mums and babies. So what they, in effect, what mum and baby brings with them into the surgical delivery situation. And then some strategies. I was asked to come up with some suggestions about what might be helpful and what might be less helpful in terms of outcomes for mums and babies and families out of the surgical delivery scenario. So hopefully I'll do some of that. Okay, so we've known for a long time about the importance of very, very early experience in long-term outcomes, not just for infancy and childhood, but throughout the lifespan. But I think over the last 20 to 30 years, there's really been a lot of kind of an explosion really in terms of research evidence and our understanding of what's going on in those early weeks and months of life that makes such a difference. This is a quote that's as good as any, I think, around the importance of this early period of life. And I think what's one of the main points of this is that this is important for all of us, and we're talking about implications across the lifespan, really, not just for infants. So that's a quote from Michael Marmot on the Health Inequality Report that was published in February 2010. Okay, so I'm going to start by talking a little bit about early brain development. I don't need to tell you how complex the human brain is. It is phenomenal in terms of its complexity and remains the most complex entity of any in the world. So what we know is that we start to grow our brains from very, very early on in life. Something like 2 to 4 weeks after conception, we are starting to grow the brain that we will need and use throughout our lives. So it's usually, often, before a woman even realises that she's pregnant, that process begins. And interestingly, because of our complexity as human beings, it's a process that continues for an extremely long time. Back to Andy's point, I think, about how long our children need us, and we continue to kind of tussle with them. The research is suggesting that the process isn't fully complete until the mid-20s. I am the proud mother of 2 young adult children, and I can certainly attest to witnessing that process as it's gone through. Certainly the adolescent challenges. And actually we're starting to come out now. I've got a 25-year-old, so he's nearly there, I reckon, which is encouraging. So the nature-nurture debate, simple answer, it's both. So the experiences that we have are vital, but also what we bring with us in terms of our genetic blueprint will also be hugely significant in terms of how the process plays out. Antenatally, the genetic factors are sort of more important, if you like, but from birth onwards, environment is the thing that determines how we progress and what our outcomes are. And you know, the experience that infants have, particularly in the context of their social development, the relationships, the care that they receive, will be vitally important in determining how the genetic kind of template that we bring with us plays out. So experience will absolutely determine whether some of our genes are switched on or switched off in those early weeks and months of life. Most obvious example of that is probably schizophrenia. So we're talking about really significant impact of the early experience. So we grow the brain that we need to cope for the environment that we're born into. So the brain grows from the bottom to the top and the inside to the outside. So obviously the kind of basic brainstem functions are there from very early on, but the bit that I was talking about that isn't fully kind of completed, that part of brain development, is the prefrontal cortex here. So the kind of higher level functions, if you will, are what are located here. So things like flexible thinking, working memory, the ability to empathise and understand another's perspective, to mentalise somebody else's experience, to have a kind of moral view on things. All those functions are right here and won't actually be fully online until around the mid-20s. And the research is suggesting actually there's a shift to later on from the research around that process being completed. So that's a depressing graph for you, especially those of us who are down that end of it. So brain cells, you probably know this, brain cells are quite interesting because we don't regenerate them in the way that we do with other cells in our bodies. So we can, and there's some new research coming through on this that makes the picture a little bit more complicated. But in essence, we start off at birth pretty much with our full complement. And although the graph is pretty depressing at one level, we've still got plenty left because 100 billion's quite a few to keep us going and to allow us to continue to learn and develop as we progress in life. So around 15% connected up a newborn, something like that. So those connections have been formed based on the experience that an infant will have prenatally. So in utero, the environment that an infant develops in will very much impact on the nature of the brain circuits that the baby kind of starts their life with, if you like, from birth. So where things are going well and you've got a happy, healthy pregnancy and a well-supported mum, the brain circuits that are already set up in that infant's brain at delivery will be very positive and we will be geared up for positive experiences in life. However, for some mums and babies, obviously, things don't go as well. And for example, if you've got a very stressed mum, very hostile environment, very kind of frightening context for the mum and the pregnancy, then that infant will have a very different set of brain circuits in place once they reach the point of delivery to the infant who had a more positive kind of antenatal experience. Is that all making sense? And then obviously the experiences that we have going forward will be contributing to that process. So around 12 months of age, the infant will have around 75% of the kind of circuits and connections in place that they will take forward. And by 2 years, around sort of 82-85%. And at this stage, we've already reached the point where the brain will start discarding the circuits that are not well established, that are not being used frequently. So again, this idea about the early weeks and months of life are the period that we kind of grow the brain that we need, really. So the circuits that keep being reactivated as a result of our experiences will become well established and hardwired. The circuits that are set up on the basis of very occasional experiences will actually not become established, and we will kind of ditch them, really, that idea of synaptic pruning. So we keep what we need and we dump what we don't need. It's a very sort of simple premise around use it or lose it, and what do we need going forward. If we continue to set up more and more brain circuits, the brain will become so complex and chaotic that we wouldn't be able to function. So it's very